Which treatments are given in the hospital and which are given in a clinic?
So with the BTK inhibitors, like ibrutinib or acalabrutinib, those can always be, I would say almost always be administered outpatient. So people can start those in the comfort of their own home with usually weekly lab checks kind of for the first month that spaces out after that. As for the venetoclax, which I was alluding to, it's kind of a little bit more of a tedious process to get started. I try for most of my patients to be able to still start it outpatient. Again, they have more frequent lab monitoring than with the BTK inhibitors, but most of my patients, even with starting venetoclax, are able to be started outpatient. There is a small subset of patients that have big bulky lymph nodes or a really high white blood cell count that are at really high risk for tumor lysis that we do have to start in the hospital, but it's a smaller population. So it's important to talk to your doctor and see what your risk is and if you'd be able to get started on venetoclax inpatient versus outpatient.